It is my privilege to both welcome and thank you for volunteering your time to the Oklahoma Mission of Mercy. My name is Donna Wood, and I will be a familiar face in the hygiene treatment area. When you arrive, please report to the hygiene section and remain there throughout your assigned time unless otherwise instructed to move. You may choose a partner with whom you would like to alternate the assistant operator position. You will need to bring your loops or safety glasses and possibly a headlight if you have one available to you. I've found camping headlamps work very well. You will locate an available chair and then put your few belongings at that site. There is a supply table specific to the hygiene division and will provide you with your necessary treatment supplies. You will pick up the supplies and return to your chair to get ready for treatment. When you are ready to provide treatment, hold up your green card signifying to a runner that you are in need of a patient. After seating and greeting your patient, please review the health history to make sure that there are no contraindications to treatment. Then explain the procedure to the patient and begin treatment. You'll have approximately 45 to 50 minutes to complete that treatment. Remember, we are not able to produce a perfect clinical result. However, the patients will leave in a much better condition than when they arrived. Once treatment is finished, you will complete the necessary paperwork by circling the procedures provided on the necessary form. At this time, your patient may be prepared for dismissal. You will hold up your red card and a runner will come to escort your patient either to the patient exit or the next assigned treatment area. Your patients are to be accompanied by a runner at all times. If you find a suspicious area and the patient has not been diagnosed for any other services, please ask the supervising dentist to check your patient to make the proper diagnosis in order to refer him or her to the restorative area. If you brought your own instruments after treatment, please bag and label them with your name before taking them to the sterilization area marked personal instruments. You'll return to that same location to retrieve the instruments when they are sterilized. If you are working in tandem with another hygienist, please feel free to rotate positions at this time. When you believe a break is needed, there is a hospitality room that can provide you with refreshments. We ask that your break lasts no longer than 15 minutes unless you have a hygienist who will utilize your vacant chair. Empty chairs are not a pleasant sight for waiting patients. If topical anesthesia is necessary, we provide hurricane gel and Oracix, but these are supposed to be used in site-specific areas only. We realize that not every unit is equipped with a Cavitron. However, we just ask you to do your best to provide the finest treatment possible without one. Dental hygiene students will be providing your patients with oral hygiene instructions and a pre-procedural rinse prior to treatment. Remember, these patients are our guests today, and our goal is to make them feel welcome and important while providing them with a wonderful service. They may not leave completely calculus-free, but we know they will leave in a better condition than when they arrived. Thank you again so much for donating your time to make a difference in the lives of Oklahomans in need. Now to provide you with some additional information. These colored cards will be placed at every unit and you will use these for your communication. When you're ready for a patient, you will hold up the green card and make sure that it is the only card that is raised so that we won't confuse anyone. You will raise your green card signaling that you are ready for a patient. When you have completed treatment with your patient, you will hold up the red card, meaning that it is time for your patient to be moved either to the exit area or to the next available treatment site. The orange card is to signify that you're having a technical problem, so at any time, if any of your equipment is not working properly, please hold up the orange card and help will be on its way. If you have a medical emergency at any time, if you'll just hold up the white card, immediately you will have help at your chair. And if you're having trouble or difficulty communicating with your patient, please don't hesitate to hold up the yellow card signaling that you need a translator because we have them for almost every language necessary.